Gentlemen, have you ever looked in the mirror, perhaps after a shower, and found a quiet question lingering in your mind? Or maybe, in intimate moments, felt that subtle, almost imperceptible pang of doubt or inadequacy, wishing for just a little more in terms of confidence, performance, or even physical presence? That inner whisper of concern about your masculinity, your self-esteem, or your ability to fully satisfy yourself and your partner can be incredibly frustrating. It's a feeling many men quietly carry, a sense of disappointment, or a fear of not quite measuring up to an unspoken ideal. But what if I told you that overcoming these feelings, and yes, addressing the physical dimensions you might be curious about, doesn't require risky surgeries, questionable pills, or snake oil remedies that promise the world and deliver nothing? What if there were scientifically proven, natural, and surprisingly simple methods that could genuinely make a difference, enhancing not just your physical attributes, but also your overall vigor and self-assurance? I'm Dr. Vanessa Green, and for over 25 years as a urologist, I've had countless conversations with men just like you. Men who, with a hesitant look, finally gather the courage to ask, "Doctor, is there anything I can truly do?" And my answer, backed by decades of research and clinical experience, is a resounding yes. You are absolutely not alone in these thoughts, and there is nothing to be ashamed of for wanting to understand your body better and optimize your health. In this series, I'm going to share medically backed ways to not only improve your confidence, but also explore scientifically proven methods related to penile length, empowering you with knowledge and practical steps you can take today. Hello, gentlemen. I'm Dr. Vanessa Green, a board-certified urologist and sexual health specialist, with over 25 years of dedicated experience helping men navigate the complexities of their intimate health. In my practice, I've had the privilege of hearing countless stories, concerns, and questions that often go unspoken in daily life. I understand that discussing penile length can be a deeply personal and, frankly, sometimes embarrassing topic. Perhaps you've felt a pang of doubt, or perhaps you've simply been curious about what's truly possible. Let me assure you, you are not alone in having these thoughts. It's perfectly normal, even natural, to wonder about aspects of your body and seek to understand how to optimize your well-being. There's absolutely nothing wrong with asking these questions, and there's certainly no judgment here. My commitment is to offer you a safe, confidential space where we can openly explore these sensitive subjects, grounded in scientific truth and medical expertise. I've seen firsthand the impact that misconceptions and misinformation can have, leading to unnecessary anxiety and even harmful practices. That's why I'm here today, to demystify this topic, share evidence-based insights, and empower you with accurate information directly from a medical professional. Consider me your trusted guide on this journey to understanding your body better and boosting your confidence, not just physically, but emotionally. All right, gentlemen, let's dive into the core of what you're truly curious about. Many of you have likely encountered countless online ads or whispers among friends promising miraculous pills, lotions, or simple exercises that guarantee inches of growth overnight. Let me be unequivocally clear. The vast majority of these are simply myths, often preying on your hopes and wallets with baseless claims. There's no magic pill for significant, lasting penile lengthening. To truly understand what is possible, we need a quick, simple look at the biology. Your penis is primarily made up of 3 spongy erectile chambers, 2 corpora cavernosa, and 1 corpus spongiosum. These structures, along with the suspensory ligament anchoring it to your pubic bone, largely determine its innate length, predominantly influenced by genetics and development. Think of it like a foundational structure. You can't drastically alter its blueprint with just a simple rub or a quick supplement. However, this doesn't mean you're powerless or that your desire for improvement is unfounded. The good news is that medical science does offer legitimate, evidence-based methods for modest length gains. We're talking about controlled, sustained mechanical traction, a principle that might sound complex but is actually quite straightforward. This isn't about pulling or tugging aggressively, but rather applying gentle, consistent force over time to stimulate cellular changes. This approach, when done correctly and under medical guidance, taps into the body's natural capacity for tissue remodeling. All right, gentlemen, now that we've built trust and understood the scope, let's dive into what truly matters. For years, you've likely been bombarded with advertisements for miracle pills or stretching devices promising inches overnight. Let me be unequivocally clear. Most of these are myths, at best ineffective and at worst dangerous. The human anatomy of the penis, primarily composed of spongy erectile tissue and fixed ligaments, isn't designed for dramatic, permanent lengthening through simple external manipulation or oral supplements. Attempting methods like jelqing without proper guidance can cause microtrauma, scarring, and even lead to Peyronie's disease, reducing your functional length and causing pain. So what are the scientifically backed pathways to optimize your length, or rather, your perceived and functional length, without invasive surgery or questionable drugs? Let's focus on two powerful, practical strategies. Reclaim your hidden length through weight management. Biologically, for many men, especially as we age, excess fat around the lower abdomen and pubic area can create a buried penis effect. The penis itself hasn't shrunk, but a portion of it is simply concealed beneath fatty tissue. Losing even a modest amount of weight can literally uncover this hidden segment, making it appear longer and more prominent. Emotionally, this physical transformation often brings a significant boost in self-esteem and body image, translating to renewed confidence in intimate settings and everyday life. Many gentlemen report feeling younger, more virile, and more connected to their partners. Practically, start with small, consistent changes. Focus on a balanced diet rich in whole foods and incorporate moderate cardiovascular exercise and strength training into your weekly routine. It's about sustainable lifestyle shifts, not drastic temporary fixes. Maximize your erective potential with optimal blood flow. Biologically, a strong, full erection is essentially a marvel of hydraulics. Your penis fills with blood, expanding to its maximal genetically determined length. Conditions like high blood pressure, diabetes, and smoking severely compromise this process by damaging blood vessels, leading to weaker, less rigid erections that might appear shorter. Improving cardiovascular health ensures your body can deliver peak blood flow when it counts. Emotionally, a robust erection isn't just about physical performance. It's deeply tied to your sense of masculinity, confidence, and ability to connect intimately. When blood flow is optimized, you feel more secure and satisfying in your sexual interactions. Practically, this means prioritizing heart-healthy habits, regular aerobic exercise, consuming nutrient-dense foods, managing stress, and, crucially, eliminating smoking and excessive alcohol consumption. Think of it as tuning up a high-performance engine. A healthy engine runs smoother, stronger, and more efficiently. All right, gentlemen, let's cut through the noise and address the crucial question that likely brought many of you here. What actually works when it comes to increasing penile length? Forget the endless promises from pills, pumps, or overnight stretches you see advertised. As a urologist, I must emphasize, most lack scientific evidence and can be counterproductive, much like trying to overstretch a rubber band past its natural limits. It often leads to damage or loss of elasticity, not sustainable growth. The scientific reality is far more nuanced. Your body's anatomy, while remarkably adaptable, possesses a fundamental structure. Significant permanent length increase isn't about magic, but about carefully leveraging existing tissues or repositioning them under specific medical guidance. The two primary methods with some scientific backing for actual length modification are penile traction devices, extenders. Biologically, these devices apply gentle, continuous tension to the penis over many months, encouraging tissue remodeling and cellular growth, similar to how orthodontic braces slowly realign teeth. Emotionally, this approach demands immense patience. Unrealistic expectations, hoping for inches versus modest gains, often cause frustration and disappointment. Practically, requires consistent wear for several hours daily over 6 to 12 months. Gains are typically modest, often less than an inch, and are most effective in specific medical contexts like Peyronie's disease or post-surgical rehabilitation. Surgical lengthening. Biologically, this typically involves cutting the suspensory ligament that anchors the penis to the pubic bone, freeing an internal portion to extend outward. This repositions existing tissue, rather than truly growing new tissue. Emotionally, this is a major decision entailing significant psychological and physical recovery, as well as managing post-operative expectations. Practically, It's an invasive procedure with inherent risks like infection, scarring, altered sensation, and often yields only a very modest perceived length increase, e.g., half an inch, potentially changing erectile angle. Gentlemen, as we conclude our discussion, I want to re-emphasize the core principles guiding everything we've covered: sound science and your holistic well-being. The approaches discussed today, from clinically backed traction devices for modest gains to surgical considerations for specific needs, are grounded in rigorous, anatomical, and physiological research. This isn't about fleeting fads or dangerous, unproven promises. It's about evidence-based pathways to address your concerns realistically and safely, always with transparent information on outcomes and limitations. My role, as a urologist, is to provide you with accurate, balanced insights, empowering you to make informed decisions for your body and life. It's crucial to approach these topics not with shame or embarrassment, but with an open mind, seeking genuine, medically backed solutions. Remember, your journey towards improved self-image and sexual health is deeply personal. It's intrinsically connected to your dignity, your confidence in intimate moments, and ultimately, the quality of your relationships and overall life satisfaction. We respect your privacy and emotional landscape completely here. This is a safe space to ask questions and explore options. Always prioritize consultation with a qualified urologist. True empowerment stems from knowledge, allowing you to make choices that genuinely enhance your entire quality of life. Now that we've shed light on the true science and dispelled the myths surrounding penile length, it's time to move from understanding to empowerment. Remember, true confidence in your intimate health comes not from chasing elusive ideals, but from informed choices and embracing your full potential. So here's my direct challenge to you, gentlemen. Choose one actionable, scientifically backed tip we discussed today and commit to implementing it for the next 7 days. Perhaps it's consistently practicing the specific pelvic floor exercises, making a conscious effort to hydrate better, or simply shifting your focus from perceived size to enhancing intimacy and connection through other means. This isn't about overnight transformations, but about taking the first sustainable step towards optimizing your health, your self-perception, and your relationships. If you found this conversation valuable, please show your support by liking this video. It genuinely helps us reach more men who are seeking honest, science-backed answers. Subscribe to Dr. Vanessa Green for more expert insights into men's health, delivered with respect and clarity. Feel free to share this video with a friend, brother, or colleague who might benefit from this candid discussion. And I encourage you to comment below. What's one specific action you're committing to this week? Or what other topics would you like me to cover? Your dignity, confidence, and the quality of your intimate life are incredibly important. You deserve to feel your best, inside and out. Thank you for trusting me with your time today. Take care, and I look forward to connecting with you in our next video.